name is Dr. Kecia Lowe. I'm an internist and a pediatrician practicing in Calavini. And I'm here to speak to you this morning about keeping your vagina healthy. The vagina is, as you know, a critical organ. It can give a lot of problems if we don't know how to care for it. And it's a very simple thing to do. The first thing to note is that the vagina cleans itself very well by itself. It does not need a lot of help. I think a lot of young ladies spend a lot of time putting soap and strong cleansers in the vagina, and this is where some of the problems begin, because when you do that, your natural pH, the acidity, the vagina is normally acidic, and so usually it's around 3.5 to 4.5. And when we start putting soap in the vagina or harsh cleansers, we make the vagina less acidic, and that ends up killing off the lactobacillus, which is a healthy bacteria that keeps the other unhealthy bacteria in line. So anytime, anything that makes the healthy bacteria not grow and proliferate will allow the unhealthy bacteria and yeast and things to grow, and then the vagina can get smelly, there can be a discharge, there could be itching and discomfort. So the first rule of thumb is to remember that the vagina cleans itself very well with just warm water. If you can clean your vagina regularly with just warm water without any soap, then you'll be doing your vagina a good favor and your vagina will be much happier. That's the first thing. The second thing is in terms of covering, keeping our vagina to cover, not letting air circulate in that area. A lot of young ladies come and they're wearing panties that are not cotton in the crotch, and so the vagina, the air does not circulate. We already live in a hot culture, a hot temperature, so that is not a good thing. And then a lot of school children wear these kind of latex, kind of stretchy, spandexy kind of shorts underneath their school uniform, and that just constricts the vagina and doesn't let you get air. So if you insist you need to wear something underneath, even in the younger school children with the polys, I recommend that they should be cotton. So that's another thing. Sleeping, in terms of bedtime, we should not sleep with a panty on. A lot of women are shocked when I say this, but it's always good to let air circulate down there. So if you have to put on something, let it be something loose like a boxer, or you can have on your nightie or even a pajama, but just not up on the vagina itself. So the vagina needs a lot of air to circulate, to get circulation down in that area. Another way that women keep their vagina unhealthy is by wearing these panty liners. It's like becomes a habit. They want to wear the panty liners 24/7. And that's not a good idea, because if you notice, the panty liners are kind of like constrictive, and they have like a waterproof quality to them so that the air again cannot circulate. If it's near to your period, right before your period, during your period, and after, it's fine to wear panty liners, but wearing them every single day is definitely not healthy for your vagina. So try to avoid wearing panty liners every day, only if you need to. If you think that, or if there's a case where you have discharge all the time, this is not normal. You will have to go and see your physician to get your vagina checked out to see, well, what's going on. A lot of women come and they say, oh, doc, that's a normal discharge. And really and truly, you shouldn't be having a discharge throughout your whole cycle. Usually it's more around the middle of your cycle when you have ovulation, or maybe just before or right after the period, but it shouldn't really be a month, every day of the month that you have a discharge. If there's a scent also, an odor, that's not good. A lot of other women want to try to douche the vagina, push stuff up in the vagina. There's no need to push anything basically up into that vagina. As I said, the vagina cleans itself. Another thing that's important is to get regular pap smears, and pap smears are a test that we take samples of the cells of the cervix to send to see if there's any kind of cancers or any kind of infections and things like that. That is something that should be done only if you're a sexually active person. If you're a sexually active woman and it's been 3 years of activity, then you should have a pap smear. So usually either 3 years of activity or age 21, whichever one comes first. So if you're a person who started having sex at 16, then by 19 you should have at least had your first pap smear. Okay, so it's really important that you go to the health centers do it, there are physicians that do it. There's also Planned Parenthood. There are different places you can go in Grenada to get pap smears done. So that's something that you shouldn't be afraid of. You should go and talk to your healthcare provider about the procedure first. If you're nervous and it's your first time, go and have a talk with your healthcare provider. Let them show you the instrument that we use, which is called a speculum, and let them explain the procedure so that you don't have to feel scared. It's really not as bad as you think.